Welcome to today's Talk of the Town. We have a great show ahead, and my first guest is Dr. Frank Barbieri. He's with Morrison Dental Associates. And Dr. Barbieri, you have actually some great information on sleep apnea and, in fact, obstructive sleep apnea, which I guess they sometimes classify as the silent killer.
Yes, yes. Obstructive sleep apnea makes up probably 85% of all the sleep problems that are out there. It's the largest problem and affects most of the people. The apnea is a breathing event, and if you like, we can demonstrate how that works.
I would like that.
Okay.
I think
okay.
our viewers would like that too.
Sure, sure. And invite the viewer to participate with us here in the holding of the breath, okay?
Okay, great. Tell me what I need to do.
Okay. When I raise my hand, just tell me when 10 seconds are up.
Okay.
Okay. And when I raise my hand, if the viewers at home would just go ahead and hold their breath.
Okay.
Okay.
We'll do it.
Okay. Here we go.
Time.
Now that's an apneic event.
Wow.
It goes from the snoring to the shutting down of the airway, and that's when the chest doesn't move and there's no air getting in, to the gasping, and it's pretty violent event sometimes the patient goes through to get air in. So that comprises an apneic event.
If we're sleeping, how do we even know if we have obstructive sleep apnea?
Well, most times it's the bed partner, but sometimes it can be loud enough that the patient himself wakes up, or the gasping part will actually thrust them up, okay? So they can tell that way. But we do, if the patient has a snoring problem or other symptoms, we will run tests to determine exactly the extent of it. Now, if you have under 5 of those events in an hour, that's considered normal. I don't consider it normal, but it's considered normal. If you have between 5 and 15, that's considered mild. 15 to 30 is moderate, and above 30 is severe. In an hour, that's a lot of events taking place. Now, many of them, when we get a sleep study back, show way more than 10 seconds. They can be 20, 30 seconds sometimes. So it's quite a blow to your system when that goes on.
It seems like it would be.
Yes.
And so what are some of the other symptoms that people would find? I mean, I guess on the part where the next day, how would they really, what are some of the things they would see? What are some of the signs?
That's a good question. They oftentimes, the patient has a lot of daytime sleepiness. If they're watching TV, they'll all of a sudden nod off, okay? And hopefully it's not while they're driving, although that is a major problem. And it's a major problem for the trucking industry and, of course, pilots. We don't want our pilots nodding off on us, you know. They also get morning headaches, okay? They will get some acid reflux. These are all part of what goes on. Things that predispose the person can be their age, sex, their weight, enlarged tonsils and adenoids, other things like that add to the problem.
What about treatments? Are there things that we can do on our own, or are there things that actually, Dr. Barbieri, things that you can help with?
Yes. There is what we call sleep hygiene. Now, in those instances, we have the patient, if they find they snore on their back, for instance, we'll tell them get a T-shirt, sew 3 old tennis balls in it, and wear it. And, of course, when you go to roll over, you know, nobody likes to sleep on 3 tennis balls, so they'll roll back to their side. This can be helpful. No alcohol after like 6 o'clock at night, because alcohol will relax the muscles even more, so that exaggerates the problem. So there are what we call sleep hygiene things that a patient can do, but if the problem has to be measured so that you can determine where you are in the process, okay? People can also lose weight, because that's a big factor in sleep apnea, and obstructive sleep apnea in particular.
They have called obstructive sleep apnea the silent killer. Is that really true?
Yes.
Wow. So it can be fatal?
Yes.
Wow.
I don't know if you recall, a number of years ago, there was a professional football player, and he had sleep apnea, and he was using a device called CPAP to breathe at night. It forces air in, so it opens the airway, and he just didn't put it on that night. And 43 years old, passed away the next day.
Do you provide additional information for sleep apnea, obstructive sleep apnea? Do you have different classes on it, or do you do, how else can you help with educating the community or our viewers?
You're welcome to call the office. We'll be happy to send them some brochures. I also will be happy to go out and go to meetings, PTA groups or whatever's, and I'll be happy to get the material because the word has to get out.
And you do have testing at Morrison Dental Associates that can help with the sleep apnea?
Well, the test
or you can send them somewhere?
Yeah, the test is what we call a sleep study, and it can be conducted in a sleep lab where you're hooked up to a bunch of devices that are measuring certain things, and you sleep there overnight. Now, in 2006, the American Academy of Sleep Medicine said that for obstructive sleep apnea, a portable study is sufficient. That's something that we recommend, and it's sent to your home, and you just put it on. It does all the recordings. The next day you send it back to the company. It's read by a pulmonologist, so he reads it because it can only be diagnosed by a sleep physician. And he gives us the report, and based on the findings of that and things that are part of our exam, we will determine what is appropriate for that patient.
Dr. Barbieri, thank you so much. Thank you for all the information. We appreciate it. And come back and tell us more, okay?
Okay. Thank you so much for having me.
Absolutely. And don't go away because we'll be right back with more on Talk of the Town.